this group is going to talk about what I think is one of the most important areas compared to, and intersects with what everybody else is talking about, actually. Because if you think about life on Earth and you think about the importance of water, it touches everything. So, and I'm a water microbiologist, so I got trained and I thought I was just going to go take a water sample, go back to my lab and analyze it. And I started working on both the waste side and the drinking water side, so I span the gamut. But I can remember being in a room full of very angry senior citizens in Florida because they wanted to put in a wastewater infrastructure, and they were all on septic tanks, and the septic tanks were contaminating their water system in Florida. So eutrophication, pollution, they had built up with very little land space, so they didn't meet any of the national requirements for land space for septic tanks. It's karst terrain, if you know anything about limestone in Florida, so it was just every time they flushed, it probably hit the canal within 8 hours. And, but these were people that were on fixed incomes. And they had a big engineering group that came in and said, well, you've got to pay $20,000 and then you're going to have to pay a sewer fee, you know, because we're going to put in sewers. And just the whole thing just exploded. And I remember that the one senior citizen was stomping his cane and asking who paid for this scientist, this Dr. Rose, to come and scare them, because I was talking about health impacts, especially with the elderly. So it wasn't too civil. And so I learned pretty quickly that I wasn't just going to work in the lab if I worked in water. And I was going to work really broadly with a really broad group of people, and I'm still learning that. So I wanted to talk about the global issue because I thought that I thought we might have a smaller group. And I think that universities, I've seen that at universities, we want to work more at the global level, at a higher level. But in many cases, there's not a mechanism to do it very well, to bring the disciplines together, to get the funding. Funding is changing a little bit. If we look at our traditional sources, NSF, EPA, NOAA, they didn't include very many opportunities for international thinking or looking at even transboundary issues, even here in the Great Lakes. You know, how do we work with our Canadian neighbors? And there's some changes. There's foundations now that have a great interest. I know that Gates, traditionally, even when they started with the Health Grand Challenges, they got a lot of letters on water, and they didn't know how to address water at all in terms of a sustainability, an investment in sustainability for solving water problems. And I think USAID is looking at creating some opportunities with NSF. Whether that will be more global, the traditional USAID has been more development. And I also think that the environmental communications, the journalism, is very tied to these issues because we hear about it. We start talking about floods and everything else. At the global level, of course, they've put up sustainability goals. And of course, water and sanitation is right there, and they're connected, the access to using water and what they call sanitation. They don't think of it as water-based sanitation, although I think most of us in this room would think of sanitation and toilets. We'd say, oh, water. I'll have to say, at the global level, they're not thinking about that. They're thinking about toilets, and they're thinking about dry sanitation and just stopping open defecation, basically. So right off the bat, we have a different perception when they say these things of the role of water. And of course, the idea, though, that there's a natural resources, there's a value to the ecosystems, and the whole idea of sharing water, valuing water, and governing water, it was put on the table because the policies for governance are very fragmented, and of course, that's one of the definitions of a wicked problem. And of course, then there's always been this idea of quantity-quality linkages, but we haven't done that very well. I'm a quality person, but I work a lot with the quantity people. And then how do we look at water for a sustainable food supply? So food security is highly, and I think that from the sustainability side, at the global level. I've been really concerned with the statistics, and I've got some of the statistics that they've got them. The next time they're going to look at their goals for water is 2015 at the global level for the developing world. And they're starting to do some small assessments, and they're finding out that they don't really have the data that they thought they had. The other thing is they have a lot of fragmentation, and they don't have innovation. WHO, United Nations, the NGOs, the groups that are trying to address the water sanitation goals at the developing world level. But even if we look in our own, in our own state, at least in Michigan, where we're water rich, our water is, the management of our water systems is very fragmented. We're one of the few states we don't have a state policy on sanitation. So each county can do what it wants on sanitation. So it's a pretty big problem in terms of on the sanitation side, I'd say. The old adage that they use dilution, dilution is still used, even though they say it's not the solution. It certainly is part of the mindset and process in terms of pollutants. The other thing I think with climate change, the technology for looking at emerging contaminants, these outbreaks that are getting global attention again, because at one time people thought vaccinations and medical treatment were going to take care of all of this, and we're just seeing that it's not the case. I know they're talking about Haiti right now in the news again. Pakistan was in the news a few weeks ago, and I have some of the latest cholera statistics. So I think that part of the wicked problem has been, for water, has been first fragmentation. There's fragmentation in our education system as well. So we educate the wastewater people over here, we educate the drinking water people over here, we educate people. We didn't even include energy in the education component until recently. We educate ecosystem and fisheries people over here. We educate health people over there. Traditionally, we look at sanitary engineering. That was part of public health, and that's gone by the wayside. And so, that's a huge fragmentation in that regard. I think the other thing is just it was linear thinking with water. Bring the clean water in, you take the dirt, you push the dirty water out, and there was no recognition of the cycle, the water cycle. Water was also seen as an infinite, resource. That water is in a cycle, and so it moves from one state to another in our globe. But the real issue then was access. And I think so, and of course the food people were way off to the water, and even though they talk about that still agriculture is the biggest user of water, there was a lot of talk about consumptive use, but there was no measurement of that. And then there was no understanding of groundwater and surface water interactions. So there was so much fragmentation on all levels of the water side. And so really, in this last point of ensuring a knowledge base on water in a comprehensive fashion that could lead to sustainability is really missing. I think both water quantity and quality equal health. And I think that we do need to think of this as a wicked problem, and then if we do, we'll think of a new approach. And there are places that are starting to do that, especially where there's stress on water. The water professionals have to provide the knowledge and the innovative technology in a very collaborative fashion. It has to be an adaptive framework. And this was because water infrastructure, I really think that we don't have a natural water cycle anywhere in the world anymore. We have a human-coupled water cycle. And I don't know any place where you could go where there's not maybe a little dam or some kind of human impact in the whole world now in terms of water. And so I don't think we have this natural water cycle that we teach our kids in elementary school. That's not what it is anymore. If you think about even the climate part of it, like rainfall and all that, and we believe humans are impacting that level, that global climate change. So we, even at that broad scale, we don't have that anymore. And because these infrastructure projects are so big and they're so costly and they should be lasting a long time, we've got to have some kind of long-term perspective for water. If they build a wastewater, a stormwater, a drinking water project, supposedly they're supposed to last 40, 50 years, right? But they don't think in those terms in either financing or benefits or innovation. It's very hard to get innovation into the water system. And a lot of people just use policy. So you saw this, wicked problems, difficult to define, resistant to resolution, have many interdependencies, multi-causal attempts to address the problems lead to unforeseen consequences. They're not stable, no clear solution or endpoint, and are socially complex. And this fits water to a T, all of these issues. They don't sit conveniently within the responsibility of one organization, that's for sure for water, and especially if you get to the global level, you've got the Ministry of Agriculture, you've got maybe Ministry of Water, Ministry of the Environment, Ministry of Health. All these ministries have little pieces of the water, side of it, and a lot of times they don't talk to each other. Changing behavior, chronic policy failure, and the classical linear approach doesn't work. So I think that if we're going to solve this, we have to have this improved understanding about our relationship with water and land and water and uses and water and economics and our society, and we don't, and even the idea of water and sanitation. If you look at the United Nations Human Development Index, and to try to delineate where people are on the economic scale, they use health and life expectancy. A lot of times they're going to use infant mortality. They might use infant mortality as another measure. So those are the two main measures in health that they use. For the education, they look at literacy. And then they look at their gross domestic product. And this gives you kind of a sense of where they place people, countries in the world based on these types of indicators, these global maps. And this is the Human Development Index, which combines some of those things, combines many of the previous indicators. And you can see where we have, the greatest stress in the African continent, and in parts of Europe. Some of this too, there's not very much data, and I'm not really sure how they get this resolution. Freshwater resources, it's often been said that we have freshwater resources, and what we have is an inappropriate distribution of people in relation to our resources, and no sense of how to use the water. And also, even though we have these available water, and you'll notice Africa, there are parts of Africa that they say they're fairly water rich when you look at how much water's there. But what they've been overlaying that with is their ability to manage the water system from an economic perspective. So this is the economic water scarcity, and so that gives you the sense of this, at least two legs. We talk about the two legs of the sustainability, right? The economics and the environment side. And the global changes all have an impact on water, yet we don't understand those very well. Certainly they've used population growth, and I'm going to show you some data by Jack Liu, in which I don't think population growth is maybe our best measure for water, although we've used that. We've got urbanization, but we don't have a good sense of the urbanization, what that means for services, either from sanitation or water supply. And of course, the whole climate change issue. I think what you heard our speaker say this morning is that these climate change models do a better job with temperature than they do with precip, right? So precip, and especially downscaling to the watershed level, difficult. And so you start grappling with very big uncertainties and variability as well when you go down to the watershed level, which is where we need to go for water. I'm suggesting with water quality and health that we actually do better, we improve our ability to look at waterborne disease and waterborne disease statistics and water quality information, because we can relate quality to health. I think from an education standpoint, we need to think about water testing capacity, building information and knowledge. And that means also building human capacity. And then for investment, drinking water and sanitation, but household connections. I think we should start thinking about household connections. So I view it from the lens that if you look at community-based water and wastewater systems, those deliver huge benefits long-term that are beyond even health. They're beyond this idea of sustainability over taps, just access to safe tap and access to a privy, which is where they're going for the developing world. And there's nobody speaking up for the utility in the developing world, saying, why don't we invest in utilities and invest in the infrastructure that we invested in the rest of the world? Nobody's really speaking up for them. They talk about the household, oh, well, we can't achieve it. But I think it's political will, and I think that was already suggested that there's partly political will in this, involved in this. Now, Jack Lew looked at the growth in households compared to population, and he looked at countries both in the developing and the developed world. And what he found is that household numbers were growing faster than population, which means that the number of people per household are splitting up, and they're creating two households. Now, we just were having this conversation with a group that's studying Malawi, and I'm going to show you some pictures and some other things with Malawi. So this isn't true everywhere, but it's true for about most of the countries that Jack looked at in both the developing and the developed world. But Malawi, it is actually the opposite, is that their population is growing faster than their households. And we may see a trend. I mean, we may see a changing trend on that depending on the economics. So Dr. Aaron Dreeland worked with Jack Lew and WHO's database, and they actually mapped this idea of this changing household size and in relationship to access to safe tap water and sanitation. So the next couple of maps I'm going to show you take this idea of changing household numbers in relationship to access. Instead of population. And this is the data set that they looked at. And not all, and you can imagine that as soon as you get to the continent that has the most problems, like Africa, is where you have the least amount of data as well. So there's a data, information, and knowledge gap there. So this is household coverage. These are household connections in terms of tap. And you can see that even in the United States, we probably have some places, especially along the borders and other places. There's little pockets, and even the developed world, where they don't have these household connections. And you can see that it's really, really poor in the African and in India and in Asia. Now, sanitation's even worse. So we're far from anybody having toilets, enough, their own privy, let alone something next to their house or in their house or anything like that. We are really far away from that, and the investments in that are seen as very large. So I see fragmentation, social complexity, technological challenges, the interconnectedness, and the multi-causal problems as being some of the challenges for water. I work in waterborne pathogens. I work with all three groups: the animals, the small animals, the parasites, and the worms, the bacteria, which is cholera, and we'll talk about that, and the viruses. I just want to mention that these are the statistics for the waterborne disease and the problems. Right now, the statistics on who's sick from water, these are estimates: 884 million people without access, 2.5 billion without access to improved sanitation. I don't know why that says it has a C instead of a G, but one of the ideas is to produce a global map of water quality. And we do have an international group that's trying to build capacity in water quality laboratories around the world to build this global map with a single yardstick. One of the things we were talking about is, what does water sustainability look like? They're talking about sustainability in many cases being very local, and depending on how you defined your boundaries, whether you're at the water basin level or the watershed level or whatever. And if you start looking at the country level, how do you even define it? What does it look like? And how do we assess value? I think one of the things we're lacking a lot is the economist side for water, both in terms of engineering infrastructure, which might be a little bit easier, but if you talk about improving health and prevention, how do we value that? The WHO is trying to use this DALI, a consistent yardstick, which is daily adjusted life years of quality of life, so that you can compare hepatitis A to X to Y to Z. And I don't think we know how to judge climate change at all. And I don't think we've addressed the social aspects of the MDGs, the Millennium Development Goals. And right now, especially on the climate side, they're talking about adaptation strategies. Yet if you go into these countries, the locals are already doing adaptation. And we have not captured any of their approaches that they're using for adaptation. They know the climate's changing a little bit, so they have designed alternatives for getting water or treating water. Now, these are the Millennium Goals for water have by 2015, and you can see 2015 is not very far away. And in fact, their intermediate assessment has said they're not meeting these. They're meeting some of them, especially on the drinking water side, but they're not meeting them at all on the sanitation side. So have the proportion of people without sustainable access to safe drinking water, and have the proportion of people who do not have access to basic sanitation. And basic sanitation is just at least some kind of a toilet or a privy or something. And one of the things they found in this study is that they were including just access to a tap or a well as improved water, and that's what they were checking. So it was going up to the country level and then to the global statistics. But when they went and did the studies, they found that none of the water quality actually was safe. So they were digging these shallow wells. They were having access to more water systems, but they weren't safe. And so it's really safe drinking water, and how do you define safe? The other thing is that people have started to look at climate change, and particularly in these extreme events, and I'm going to talk about that a bit more. I should mention that cholera and maybe typhoid are the poster children of waterborne disease. Globally, cholera, and many people are surprised to find this out. You hear about these diseases and stuff, and you always hear cholera, 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 as if cholera is the only waterborne disease out there. But actually, it's the only one reportable. Cholera is the only reportable disease at the Global National Health Assembly. So the only one that goes from the national statistics all the way to the global is cholera. Typhoid's not reportable. None of the other waterborne diseases are reportable. Water-based diseases. So the reason has been that water was a local, and the disease was a local phenomenon. And only because cholera got shipped around because of the ports, cholera has the ability to end up in the marine environment, and then it enters into the community through shipping lanes, and then it magnifies through the waste and water system, as it did in South America. And because cholera is known to cause pandemics, it's on that list. So they don't see these other waterborne pathogens as causing pandemics, but we know things like even norovirus. There's a new norovirus strain, and it's circulating around the globe, and so by the definition, it could be a pandemic. But you got to understand that waterborne diseases, if you say outbreaks or anything like that, or pandemics, it has a political ramifications, and there's political definitions tied to it. So even with Katrina, there were certain things that fit the traditional definition of an outbreak, but the Centers for Disease Control would not report it as an outbreak. And that was a political decision to say, no, we don't believe this is an outbreak. And typhoid is actually, there's more cases and deaths associated with typhoid, but it's not reportable at the global level. And typhoid also has some antibiotic resistance emerging. And if we look in the United States, we didn't really have much cholera in the United States. We had typhoid. Typhoid was the big disease when we first, started handling our water and wastewater. This is what cholera looks like at the global level. This is 1995 to 2005. You can see Africa and Asia and Eastern Europe and to a certain extent South America, Central and South America are carrying the burden of disease. And but now we have a lot of other things we're worried about. We've got O157, we've got Legionella, which is a respiratory disease, Helicobacter, which causes ulcers and potentially cancer. But you can be infected for a long, long time and not know it. And the other thing is that people think waterborne diseases cause just diarrhea and you're going to get over it. Okay, so you have 3 bouts of diarrhea. If we have nutritional, let's talk about nutrition, improving nutrition. Let's talk about access to health care. Then we'll be fine. But what we're finding out is there's a lot of chronic diseases associated with that. And multiple pathogens plus nutritional aspects cause more of the chronic problems. And we're seeing that in the United States too. The outbreak in Canada, in a small town in Walkerton in the province of Ontario, that was E. coli O157 and Campylobacter. Well, the O157, of course, is associated with the transplants, kidney transplants that about 20 kids need now into the future, and the Campylobacter is probably associated with some of the other symptoms that people are having, reactive arthritis, joint pains, all these things. We don't know for sure. So none of this is captured really when we talk about trying to improve health. This is the Helicobacter. They're suggesting that there's really a high level of infection. These infections are spread fecal-oral. And so they get to the next people, the next person through contaminated food and water. And people just are colonized and they're never treated. And so long term, that means ulcers and that means cancer down the road, if you live that long. And then, of course, the morbidity, mortality is very big in the sensitive populations. In the United States, we've calculated that any one point in time, about 30% of our population falls into a sensitive category. Of course, we go through, as an individual, we go through these as we go through our life. But in the developing world, it's as high as 60%. It depends on where you are and the role that AIDS is playing. If you have a lot of AIDS in the population, it's really devastating in terms of environmental pollution. Climate, both direct and indirect effects are very big, and of course the direct effects get a lot of attention right off the bat. But as we're seeing in Pakistan and we're seeing in Haiti, after these big events, if you displace people, the effects, the indirect effects, are the ones that are difficult to manage. And that's down the road in terms of water and sanitation. We do know in the United States, this is a picture of a study we did on about 50 years of outbreak data in the United States. And every place there's a donut-like looking spot is a drinking water outbreak in a community that's statistically related to the extreme rainfall events. So we've been able to statistically show that climate is playing a role in outbreak scenarios. I mean, the big events, the plane crashes. And this is what the Washington Post, they took our data, they plotted it, and then they added CSOs on top of there. Although we didn't look at land use, but obviously the source of these pathogens is what we do on land. But you know, they were making the point that where you have poor wastewater infrastructure, you also have a lot of these outbreaks. One of the more recent outbreaks in the Great Lakes region was in Putin Bay. This is a groundwater. It's right in Lake Erie. That's the rainfall event in the blue. And this happened and I don't know, Lois, if you guys were monitoring in 2004, that year, because there was so much rain. This is like 200% the 50-year average hitting that part of the Great Lakes region. And the red is the disease cases. And it was both local people and tourists that got sick. And of course you can see where public health came in, is after all the disease cases. And public health is always late in these things in terms of responding. But we also found that wind events, and wind is a really important predictor, and it's really hard to get wind from the climate signatures. But wind was really important in terms of moving the contamination around and causing the outbreak. The extremes are really interesting. Not too many people have looked at drought. What we're hypothesizing and what we want to look at in Malawi is that maybe drought is associated with accumulation and concentration of contaminants, and that you might have smaller spatial risks, and that's why it hasn't been identified. I mean, drought is seen as important in terms of crops, but it hasn't been seen as important in terms of health. But I think it might be a smaller scale. Whereas on the high end, the high precipitation is associated with transport of contaminants and a larger scale risk. That's our working hypothesis, and it's not something we've tested yet. These are some of the other disasters that they've looked at: 22 earthquakes, 2 volcanic eruptions, and 2 tsunamis. And basically, I thought it was interesting that they said negligible risk for epidemics after geophysical disasters. So they didn't use flooding in this study. And I often wondered what they meant by negligible and what people meant by negligible, because basically in 73% they didn't have any reports, and people are just responding to the disaster. So they don't report on this stuff, and they don't go down, you know, in enough time. But in 26 of the disasters, they did report a lot of these illnesses, but they said there was no outbreak. So again, it came back to the definition of what an outbreak is and whether politically the area was going to say, oh, we're having an outbreak. Because a lot of times they won't. Flooding is the #1 cause of disasters, though, globally. And even the definition of flood is not something that's consistent. I don't know if it means 1 inch over what area, you know. So there's no global definition, to tell you the truth, of flooding. And a lot of our infrastructure on water traditionally is about flood control, if you look even back in ancient times. And I've got the references, but we do know that after these big flooding events caused by hurricanes and other types of things, that at least for cholera, at least at the global level, we see a lot of cholera, and we also see parasites, and we see viruses, zoonotic pathogens, typhoid, and that kind of thing. So you guys saw the African continent, and you know, MSU has a really strong international programs, and I don't know, you may want to talk more about this, but there's a long history of MSU working in Africa, and a long history of MSU scientists working in Malawi, which is this tiny little country right here in the middle. And I was asking the Malawians how come the borders ended up this way, and basically the Brits divided them up. And they used to actually, I think, it used to be, you know, more, a political boundary with, you know, tribes that had some commonality. And I guess the Brits, you know, divided them up this way. But one of the things that's interesting about Malawi, it has this lake, Lake Malawi. It's an important lake from a biodiversity. It's one of the most important lakes from a fish biodiversity. It also provides a lot of water, but it's transboundary. So the lake itself has between Mozambique and Tanzania and Malawi and Zambia, they all have share some of the watersheds. So it's actually a transboundary watershed, so it's quite interesting. And there's a picture of Malawi. These are some of the water systems. I'll show you some of the statistics. This is their main sources of water. They say in the dry season, because Malawi is very interesting, it has a very distinct dry season and a very distinct rainy season. And I think in the rainy season, people just go wherever and get water because it's running everywhere. So, and I just read an article recently that said that even though people knew that maybe the water quality wasn't that good, that it's this distance they go to get water. So that really means a lot to them, how far they're going to go. So if they can go someplace closer, even though they don't think the water's very good, that's where they're going to go. And so this is what they use in the dry season. They use a lot of groundwater there, and shallow groundwater. And one of the issues is the cost of building deeper wells. And the shallow ground wells go dry, and especially under these changing climate conditions. And they do have some drainage, and they use mostly these pits for their wastewater, if they do have access to wastewater. These pit latrines. And so this shows you really small numbers, mostly in the urban centers that have flush toilets at all. There is a couple of wastewater plants in the larger cities, in Blantyre and Lilongwe. But you can see there's a huge amount. They have no facility at all. And in fact, even those with the traditional pit toilet, they probably use a lot of open defecation in many cases, if they don't like it in going into the pit toilet. Of course, they go long distances to get water. They do have taps, and in some cases the tap is treated at the place of, and they have microfinancing systems in some cases. And there's the lake. The lake is not exploited too much yet for tourism. There's not a huge amount of tourism. Malawi is one of the poorest countries in Africa. And, but that's one of the issues in the future, is this idea that tourism could become something important, and there's that double-edged sword to tourism. This is the access to water and sanitation, and you can see the URB is urban, and the RUR is rural. And you can see at the household level, there's hardly any household connections. It's really about these taps and outside pit latrines. There's the Lilongwe River. And then they also have, actually from a quantity side, the Malawian scientists have pretty good data on quantity, which is pretty interesting, even though they don't have a lot of monitoring and gauges. But Malawi's had its issues. This was a very interesting outbreak here because it was a case of drought followed by flood, and it was a food crisis, a water crisis, and a disease crisis. They said all at the same time. So this was a big issue. And they're concerned about those kinds of things happening again. And it probably is going to, because they're so interconnected. Just have a few more slides and then with some discussion. You know, what we're trying to look at, and you know, one of the reasons I came to MSU is because I was interested in working at the international level. I've been working with the International Water Association for a long time. And I'd worked in South America quite a bit on water quality and working with universities on setting up labs for parasites and viruses and alternative ways of testing. I started working in Asia. And MSU had this, you know, kind of hat that said we want to be work at the international level. And when I worked in Florida, and I worked in the Florida Keys, and I think I was telling somebody at the break, one of the things about the Florida Keys is the Florida Keys had no water, right? Essentially, it had a very small lens of fresh water. And there was no way you're going to put people down there unless you got some fresh water down there. So early on in the history of the Keys, they built a pipe of fresh water, right? All the way down, from Florida, Miami area, all the way down the Keys. I mean, before they had used distillation. So if you went to Key West or places like that, they actually imported wood, and they distilled their water. So there was no way they were going to support a population or a tourism industry without a water pipe. The water pipe was controversial because they increased it. It used to be a small pipe, and then it got bigger. Now, they brought all this fresh water down. They built houses down there, but they never thought about their wastewater because they had a marine system, and they presumed that putting wastewater out into the marine system through septic tanks, through cesspits, outfalls, the environment was going to take care of it, right? The environment was going to take care of it. Well, then you got refrigeration, you got mosquito control, you got a bigger road. That was controversial as well. And this little strip of land is supporting huge amounts of people and tourism. They knew the reef was dying. They knew there was nutrients down there. They knew the wastewater was a problem. It was a no-brainer. You could walk around and see it. We started working with the USGS and NOAA down there looking at human pathogens. And we had two strategies. We were surveying things for viruses and other pathogens. And then we were also doing tracer studies. We were actually flushing little virus tracers down the toilet. And so pretty soon people started looking at our science. And I can tell you it took 8 years before the state and before the feds said we're going to put the $1 billion into wastewater management in the Keys. So that's how long it took the science to move the political will down there. And basically it was like, okay, if I flush my toilet, what goes down the toilet ends up near my boat in that little canal in 8 hours. Yep. So we had that study. Then we had studied that there were viruses everywhere. You know, then there was an outbreak. The health department found an outbreak in the Swim Around Key West event. And so all these things started happening, and it moved the notch. It moved the knowledge up and the concern up to a level where they started investing. And I think that has to happen at the global level. At the global level, we use fecal coliforms, if even that. We use maybe E. coli, but we don't measure other waterborne pathogens well. We don't measure water quality. If we can create all these global maps, we have not one global map on water quality, not even one parameter, not even nutrients. There's no global map. So no country can compare itself against its neighbor. There's no political pressure there to say, what are we doing in water quality? And people know about it already, but it's not visualized, it's not known. And so there's a group of us that through the International Water Association, we work together called the Health Related Water Microbiology. And we've got about 43 labs now globally that want to map global pollution, and especially from sewage. And we can use molecular markers. There's a whole advantage to using new technology to do these new things, to provide knowledge for decision makers, for investments. But I do think from the engineering side, the hydrology side, the climate side, all of that is needed in these areas too, if we're going to come to sustainable solutions. The WHO is doing assessment right now, and they want to look at strengthening monitoring mechanisms to measure sustainable access, what they're calling sustainable access, to safe drinking water and basic sanitation at the global, regional, and national levels. I think they need help in describing what they mean by sustainable, what they mean by safe, what they mean by regional, all of these things. There really needs to be more discussion and more science brought into this discussion, as well as economics and environmental issues. So I think that's my last slide. It's right there. Yep. A couple of kids in Lolongme playing in the pool. Any rate, new policy has just been developed in Malawi, a national policy on water, and so that also facilitates some activities. Democratization has gone forward in Malawi, and a lot of people that were working in Kenya have moved over, interestingly enough, because of the unrest, the political unrest in some of these countries where they worked before. And so it's also the political stability that affects all this. Anyway, that's all I really had. I wanted to give just this kind of broad overview, and there is a group from MSU working in Malawi. There's a granting program from National Science Foundation called the Water Sustainability and Climate Program. MSU is engaged with University of Minnesota Duluth with the Malawian scientists to do a planning grant. So you've got a category 1, which is a planning grant, and the big grant, category 2, is for $5 million. And the goal is to go towards that $5 million to write a proposal which will be submitted and be competitive. And the whole issue is to look at this issue of water and sustainability and the impacts of climate as it relates to the social structure of the systems. And it's mandatory. What's interesting about this program, and maybe it reflects the discussion we're having here even, is that it mandates that social science, engineering, hydrology, biology be part of the proposal. So it has to be multidisciplinary. And so it's quite an interesting program. I don't know what's happening with USAID and the NSF. That'll be very interesting because I know that there was a lot of complaints about the way USAID was run, that you couldn't really do science, you couldn't do research, you couldn't engage people and the way they were putting the money in. It was just supposed to be capacity building and education, but it wasn't really reaching those goals through the way they were delivering that. And so it seems like this new initiative is a way for money to come in and get that research and science as part of the economic development and capacity building piece, which makes sense, you know. So I think these are opportunities for us, and a lot of these projects, you obviously have to go outside your own university